Speaking as a doctor and a mother, I believe there's nothing more important than giving babies a healthy start in this world. Good nutrition is essential to that healthy start and should be an expectant mother's top priority, whether she's hoping to get pregnant, is already pregnant, or has just delivered her baby. But the sad reality is that too many newborns don't get the healthy nutrition they need to thrive. In fact, according to the World Health Organization, close to 3.6 million infants die during the first 30 days of life. Two-thirds of these neonatal deaths occur in southern Asia and sub-Saharan Africa. And more than one-third of child deaths are thought to be caused by maternal or child undernutrition. Pregnant women often have one or more deficiencies in micronutrients. The most common deficiencies are in key nutrients such as folate, iron, zinc, and vitamins A, B6, B12, vitamin C, E, and riboflavin. But the good news is that these deficiencies are easy to prevent if expectant mothers make a commitment to eating a variety of healthful foods daily and to take quality supplements. There are many issues related to poor nutrition that can have a negative impact on an expectant mother during the pregnancy as well as after her pregnancy. One of the most dangerous of these is anemia, which is often caused by iron deficiency and affects more than 2 billion people around the world. How much iron you absorb is highly dependent on your diet, and there are foods that can actually inhibit how much iron you absorb from your diet. Tea and coffee, for example, are two commonly consumed beverages that can actually inhibit iron absorption. Pregnant women with significant anemia may have an increased risk for poor pregnancy outcomes, including early delivery and low birth weight of the baby. Glucose intolerance, or the body's inability to regulate blood sugar, is another serious condition that may have a negative impact on pregnancy. If glucose intolerance or gestational diabetes is first diagnosed during pregnancy, the mother has between a 20 and 50% chance of developing full-blown diabetes in the next 5 to 10 years after the pregnancy. Gestational diabetes also can cause a variety of labor and delivery complications, and it is also dangerous for the newborn. It may even cause fetal death. But the way to prevent this is to control pregnancy weight gain through exercise and following a healthy diet. High blood pressure or hypertension is another potential risk for pregnancy. When it occurs, it can decrease the blood flow to the placenta, which can increase the risk of labor difficulties, including toxemia, also known as preeclampsia. Poor nutrition, including inadequate intakes of vitamin D, diets that are high in sodium or low in potassium, as well as just being overweight, can all increase the risk for hypertension. Osteoporosis is a long-term complication of pregnancies, and the more pregnancies a woman has, the higher her risk. Adequate intakes of calcium and vitamin D, along with having an active lifestyle, are actually the best ways to avoid osteoporosis. While it's very important that women of childbearing age focus on good nutrition before, during, and after pregnancy, I should also note that focus should start with achieving a healthy weight prior to becoming pregnant. A BMI or body mass index of 20 to 25 is ideal. Research shows that obese women, that means having a BMI of greater than 30, as well as women who are underweight with a BMI of less than 20, all tend to have problems becoming pregnant and also are at higher risk for complications both during pregnancy and childbirth. Unfortunately, in Malaysia, for example, the number of obese women is on the rise, growing from 7.6% in 1996 to over 17% just 10 years later in 2006. This increase has serious implications for pregnancy complications and for child health. Mom being overweight or obese before or during pregnancy can actually increase the risk for serious health conditions such as gestational diabetes, hypertension, toxemia, and even maternal or child death. So helping moms get to and maintain a healthy weight before, during, and after pregnancy is vital. So poor nutrition doesn't just impact the mother, but it also can have a potential negative impact on the newborn baby as well. It can increase the risk of intrauterine growth retardation, premature birth, low birth weights, birth defects, and increased risk for infections. I mentioned maternal anemia earlier, and I wanted to add that anemia doesn't just affect the mom, but can also create an iron deficiency in newborns, which puts the baby at increased risk for delayed growth and development. Obesity, type 2 diabetes, and hypertension may all take root in a child during early development through gestation and lactation. In fact, a recent review study found that poor prenatal dietary intakes of protein and micronutrients are associated with an increased risk of adult obesity. That certainly is no one's idea of giving a baby a good start in life. So maternal nutrition has a long-lasting impact. There are so many nutrients that are essential to a healthy pregnancy and a healthy baby, and it's important that pregnant women eat a very healthy diet filled with fruits, vegetables, fiber, low-fat protein, and healthy fats. But because at this important time in life it's really difficult to get all that is necessary from diet alone, I highly recommend that women hoping to become pregnant or those who are already pregnant add high-quality supplements to their daily regimen. What a woman eats even before becoming pregnant can impact her baby's health. Antioxidants such as vitamins E, C, beta-carotene, and selenium all help protect the cells of the reproductive system from oxidative stress. Another important nutrient is folate. Supplemented daily with at least 400 micrograms of folic acid around the time of conception can significantly reduce the incidence of neural tube defects in the baby. That's why even for those who are just in the pre-pregnancy planning stages, I strongly recommend taking folic acid supplements. It's really never too soon, and unfortunately when supplementation is begun after the first trimester of pregnancy, it's too late to prevent these birth defects. During pregnancy, women have additional specific nutritional needs. The need for protein increases, so it's important that expectant mothers get plenty of high-quality lean protein, especially soy, eggs, lean meat, and dairy. Pregnant women should also focus on healthy fats, especially the omega-3 fatty acids EPA and DHA. EPA supports the heart and immune system, while DHA plays an incredibly important role in the development of the brain, eyes, and central nervous system of the baby. I recommend an intake of at least 500 milligrams of EPA plus DHA during pregnancy and at least 300 milligrams of DHA daily during breastfeeding. I mentioned folate and iron before, but they're important during pregnancy as well. Iron is an essential component for the creation of hemoglobin and myoglobin. Both of these proteins help carry oxygen to the cells of the baby. And a recent study found that supplementing with iron and folic acid has a strong protective effect against early neonatal death. In fact, some 20% of infant mortality could be averted in Indonesia alone by universal iron and folic acid supplementation during pregnancy. So clearly, both iron and folate are essential for a healthy pregnancy and a healthy baby. The need for iodine also increases during both pregnancy and lactation. Iodine is an essential mineral that we need to produce thyroid hormones throughout our life. An iodine deficiency in mom increases the risk for both mental and physical impairments in her child. Vitamin A is also essential for immune function and for reproductive and fetal health. 2,500 international units is the recommended intake. Expectant mothers also need more B vitamins, including thiamine, riboflavin, niacin, pantothenic acid, pyridoxine, which is vitamin B6, folic acid, and vitamin B12. Folate and vitamin B12 are required for rapid cell production and, as I mentioned earlier, to help prevent neural tube defects. Alfalfa has a long history of use by nursing moms to help stimulate the production of breast milk. This is safe and nutritious in moderation and can be taken in tablet form. Just be sure to introduce it into your diet gradually. And finally, minerals such as calcium, zinc, and magnesium taken during pregnancy not only help to build babies' healthy bones and teeth, but also help to protect the mother's bone density. After the second trimester, I also like to remind pregnant women that they really only need an extra 300 calories per day. So it's important to increase the nutritional intake without adding too many extra calories. This means making good food choices, such as minimizing consumption of high-calorie fast foods and making sure that the daily diet consists of a balanced amount of proteins, carbohydrates, and fats. Protein smoothies can be great options, and of course, continue taking quality supplements. So the truth is that quality nutrition and a healthy weight are essential throughout our entire lives. But there's no better time for women to begin these healthy habits than during the childbearing years. So often, moms focus entirely on doing the right thing for baby, which is clearly important, but they often don't give enough thought to taking good care of themselves, both before pregnancy as well as during and after pregnancy. But if we learn to take care of ourselves as well as our babies, the result will be more healthy moms and more healthy babies.